Stick out your tongue and look at it in the mirror right now. Go ahead, I'll wait. If you see a thick white coating, cracks running down the middle, or scalloped edges along the sides, please don't ignore what you're looking at. I'm Dr. Amara Obi. I trained in internal medicine, and for the past 11 years, I've split my time between modern clinics and traditional healers, including my own grandmother in West Africa, who could read entire organ systems just by looking at someone's tongue. She was right more often than the lab tests. And I want to be honest with you. For the first few years of my training, I dismissed what she did. I thought I had outgrown the village. It took me a decade and a quiet crisis of faith in my own profession to realize she had been right the whole time. Modern medicine just hadn't caught up yet. Here's what nobody told you in school. Your tongue is the only internal organ visible from the outside of your body. Every morning, before you brush, before you drink water, before you do anything else, your tongue is showing you a real-time report card of what's happening 6 feet down in your gut, what's circulating in your blood, and what your liver, kidneys, and thyroid have been struggling with overnight. A 2024 review from the Cleveland Clinic confirmed that specific tongue patterns predict liver dysfunction with 78% accuracy before any blood test catches it. 78%. That's not a rounding error. That's a warning hiding in your own mirror. In the next 18 minutes, I'm going to walk you through 7 specific patterns. There's one in particular, the one most adults over 40 already have right now and don't know it, that I'll get to early because once you understand it, you'll start noticing it on people everywhere. You will want to stay for that one. But first, before we begin, drop your age in the comments right now. Are you in your 30s, 40s, 50s, or beyond? And tell me, when you looked at your tongue just now, what did you see? I read every single comment on this channel. Your answer helps me understand who I'm speaking to and what information matters most. This community has grown into something special, and that's because of you showing up wanting to live better. So tell me where you are, and let's get into this together. We're going to start with the sign almost everyone watching this video has at least sometimes. And the remedy I'm about to share with you is something my grandmother used 50 years before modern science had a name for it. Let's start with the thick white coating across the surface of your tongue. I know what you're thinking. I just need to brush my tongue better. That's what almost every patient tells me when they first notice it. And I have to gently correct them because that white coating is not a hygiene issue. It's a signal from your gut that your digestive system is burdened, and no amount of brushing will fix what's actually causing it. Here's what's happening inside your body. That coating is primarily made up of dead cells, food particles, bacteria, and most importantly, a yeast called Candida albicans. Candida lives in everyone's mouth and gut in small amounts. It's normal. But when your gut microbiome is out of balance, usually because of a recent course of antibiotics, a high sugar diet, chronic stress, or weakened immunity, Candida overgrows. And the first place it shows up visibly is on your tongue. Think of your gut microbiome like a garden. In a healthy garden, you have hundreds of different plants growing in balance, each one keeping the others in check. When Candida overgrows, it's like one aggressive weed taking over the whole garden, choking out the diversity that keeps you healthy. That coating on your tongue is the weed pushing up through the soil where you can finally see it. For women over 40, this is particularly concerning. After perimenopause begins, estrogen levels shift dramatically, and estrogen plays a critical role in maintaining the diversity of your gut bacteria. Researchers at Johns Hopkins have shown that the gut microbiome of a woman over 45 is on average 30% less diverse than the same woman's microbiome at 30. Less diversity means less resistance. Less resistance means more candida. More candida means that white coating you're looking at. A 2023 study published in the Journal of Oral Microbiology found that adults with persistent tongue coating had measurably higher rates of brain fog, post-meal bloating, sugar cravings, and recurrent yeast infections compared to adults with clean pink tongues. The coating wasn't the problem. The coating was telling them about a much larger problem they hadn't noticed yet. Now, here's the practical fix, and I want you to hear every word of this because this is one of the most powerful single things you can do for your gut health. It's called oil pulling. And it works because it physically lifts the candida and the bacterial film off your tongue while drawing toxins out through your oral mucosa. Here's exactly how to do it. Every morning, before you do anything else, before water, before coffee, before brushing, take 1 teaspoon of cold pressed coconut oil. Put it in your mouth and let it melt for a moment. Then swish it around for 10 minutes. Yes, 10 minutes. Set a timer the first few times until your jaw gets used to it. When the time is up, spit the oil into a tissue and throw it in the trash. Never into the sink because the oil will solidify and clog your pipes. Then rinse your mouth with warm salt water. Half a teaspoon of sea salt in a glass of warm water. Swish, spit, and only then brush your teeth as normal. Do this for 3 days and you'll start to see the coating thin. Do it for 2 weeks and your tongue will return to a healthy pink color. The lauric acid in coconut oil has documented antifungal properties. It directly disrupts the cell wall of Candida, while the swishing action mechanically removes the biofilm that brushing alone can never reach. Pair this with cutting refined sugar and processed bread for those 2 weeks. Sugar feeds the Candida. Starve it, and it disappears. Now we move to the sign I teased at the beginning, the one most adults over 40 already have right now and don't know it. It's a pale tongue. Look at the color of your tongue. A healthy tongue should be a soft pink, close to the color of the inside of your lower lip. If yours looks washed out, light pink, almost grayish, or close to the color of raw chicken, please don't ignore what you're looking at. A pale tongue is one of the earliest and most reliable signs of iron and B12 deficiency, and it shows up months, sometimes years, before standard blood tests will catch it. Here's what's happening biologically. The pink color of your tongue comes from the dense network of capillaries just beneath the surface, filled with oxygen-rich, hemoglobin-rich blood. When your iron stores drop, your body produces less hemoglobin, which means less oxygen carrying capacity in those tiny vessels, and your tongue loses its color. When B12 drops, your red blood cells become abnormally large and inefficient, carrying less oxygen per cell, and again, your tongue pales. Why does this hit women between 35 and 55 so hard? 3 reasons. First, decades of menstrual blood loss have steadily depleted iron stores in a way that men never experience. Second, perimenopause and the years leading up to menopause involve heavier and more unpredictable bleeding for many women, accelerating iron loss further. Third, the absorption of B12 from food declines naturally with age, especially in women who have been on acid-blocking medications like omeprazole or famotidine for reflux, because B12 absorption requires stomach acid to release it from food. A 2022 study published in The Lancet Hematology found that 38% of women between 40 and 55 in the United States had functional iron deficiency, meaning their stores were depleted enough to cause symptoms, but only 12% of them had been told by their doctor that they were anemic. The reason is that doctors typically only diagnose iron deficiency when hemoglobin drops below the cutoff for anemia. By that point, you've often been deficient for years. The pale tongue catches it long before the blood test does. Here's the practical fix. Ask your doctor for a full iron panel, not just hemoglobin. You want serum ferritin, total iron binding capacity, transferrin saturation, and serum B12 at minimum. Ferritin is the most important. It measures your iron stores, not just what's circulating. For women over 35, ferritin should be at least 50, ideally 70 to 100. If your doctor tells you ferritin of 15 is normal because the lab range starts at 10, please get a second opinion. That number is normal for survival. It is not normal for thriving. In the meantime, eat heme iron from real food sources, grass-fed red meat twice a week, pasture-raised eggs daily, sardines or wild salmon 3 times a week. Pair iron-rich foods with vitamin C. Squeeze lemon over your steak. Eat strawberries with your eggs, because vitamin C increases iron absorption by up to 300%. And separate your iron-rich meals from coffee and tea by at least 90 minutes, because the tannins in both block iron absorption almost completely. For B12, if you've been on acid blockers for more than a year, request a methylated B12 supplement. Methylcobalamin, not the cheap cyanocobalamin form. Sublingual is best because it bypasses your stomach. Within 60 to 90 days of correcting these deficiencies, your tongue will return to its proper pink color. That return is your body telling you that your blood is rebuilding. Now look at the sides of your tongue. If you see a wavy, indented pattern that looks almost like the imprint of teeth pressed into the edges, you're looking at scalloped edges. And this is the next sign I want to walk you through because it points to one of the most underdiagnosed conditions in women over 40. Scalloped edges are sometimes called wavy tongue or teeth-marked tongue, and they signal one specific thing. Your body is silently retaining fluid. Your lymphatic system is sluggish, and very often your thyroid is underperforming. Here's the biology. Your tongue is mostly muscle. When you have low-grade fluid retention from poor lymphatic drainage, your tongue swells slightly throughout the day and presses against your teeth. Over time, those teeth leave permanent imprints in the soft tissue. The scalloping is not from the teeth themselves. It's from a swollen tongue meeting them. The most common reason for that swelling? An underactive thyroid. Your thyroid hormone regulates fluid balance throughout your entire body. When thyroid function drops, even slightly, even within the normal range your doctor has been telling you about, fluid begins to accumulate in soft tissues. The earliest place it shows up is in your tongue, your fingers in the morning, and your face when you wake up. For women over 35, this matters enormously. Subclinical hypothyroidism, meaning your TSH is technically in range, but your actual thyroid function is impaired, affects an estimated 1 in 8 women in this age group. Most of them are told their labs are normal. Most of them spend years being told their fatigue, weight gain, brain fog, and hair thinning are just stress or just aging. A 2023 review from the Mayo Clinic specifically called for tongue examination to be added to the standard thyroid evaluation because the scalloping is often present years before TSH becomes officially abnormal. The practical fix here requires working with a doctor, but you have to ask for the right tests. Don't accept a TSH-only thyroid panel. Ask for free T4, free T3, reverse T3, and thyroid antibodies, both TPO and TG. These 5 markers together will tell you the truth about your thyroid in a way that TSH alone never can. Print this list out, bring it to your appointment. In the meantime, support your lymphatic system every single morning with a 60-second routine. Dry brush your skin from your feet upward toward your heart before you shower. Drink 16 ounces of room temperature water with lemon, and do 30 jumping jacks or rebounds on a small trampoline. Lymph has no pump. It relies on muscle movement to circulate. Pair this with reducing iodized table salt and switching to mineral-rich sea salt or Himalayan salt. The trace minerals in unrefined salt support thyroid function in ways that pure sodium cannot. Right here, I want to pause for just a moment. If what we've covered so far is opening your eyes the way it has opened the eyes of so many women in this community, please take 1 second and hit that like button. And if you're not yet subscribed, I invite you to join us. I publish evidence-based content built specifically for women over 40 who are tired of being told their symptoms are normal. Because you deserve information built for your biology, not recycled advice written for everyone else. Subscribe and ring that bell so you never miss a video. Now let's get into the next signs. And the next one is one almost every chronically stressed adult develops without realizing. Look in the mirror again. If you see a deep groove down the middle of your tongue, sometimes with smaller cracks branching off it like a tree, please pay attention. In Western medicine, this is sometimes called fissured tongue and dismissed as a harmless anatomical variation. In traditional Chinese medicine and the West African healing traditions my grandmother practiced, this pattern has been understood for centuries as a signature of one specific thing: chronic depletion of the body's reserves. Modern research is now confirming what those traditions always knew. Cracks in the tongue correlate strongly with three specific deficiencies: chronic stress that has depleted your B vitamins, low-grade dehydration that has gone on for months or years, and impaired absorption of nutrients in the small intestine. Let me explain why. Your tongue is one of the most rapidly regenerating tissues in your body. The cells on the surface of your tongue completely renew themselves every 7 to 14 days. That regeneration requires enormous amounts of B vitamins, specifically B12, folate, and B2, and it requires consistent hydration at the cellular level. When you've been chronically stressed for months, your adrenal glands consume B vitamins at 3 to 4 times their normal rate. When you've been chronically dehydrated, the cells of your tongue cannot maintain their normal plump structure. Together, these two stressors cause the tongue tissue to literally crack as it tries to regenerate without the building blocks it needs. For women between 35 and 55, this pattern is even more common because perimenopausal hormonal shifts further increase the body's demand for B vitamins. A 2022 paper in the American Journal of Clinical Nutrition found that 47% of women in this age range were functionally deficient in at least one B vitamin, even when their standard blood tests came back normal. The standard reference range for B12, for example, is so wide that you can be at the bottom of normal and still be symptomatic for years. Here's the practical fix. First, get a real B vitamin assessment from your doctor and ask specifically for methylmalonic acid and homocysteine levels alongside the standard B12 test. These two markers will catch a deficiency that the basic test misses. Second, hydrate the right way. Most people are drinking water but losing it just as fast because they have no minerals to hold it in. Add a pinch of unrefined sea salt and a squeeze of lemon to your morning water for 30 days. You'll notice a difference in your tongue within 2 weeks. Pair this with one nutrient-dense meal per day that includes real food sources of B vitamins: pasture-raised eggs, wild salmon, dark leafy greens, and grass-fed liver if you can tolerate it. Supplements can help, but food sources are absorbed at 3 times the rate. Your tongue will tell you when it's working. The cracks will begin to soften and fade within 30 to 60 days. Look at the tip of your tongue now. If the very tip is noticeably redder than the rest of it, almost like it's been mildly burned, this is a sign of systemic inflammation, often originating in the heart and circulatory system. In traditional medicine, the tip of the tongue maps directly to the heart. Modern research is now confirming that ancient pattern. A 2023 cardiology paper found that patients with persistently red tongue tips had measurably higher inflammatory markers, particularly C-reactive protein and homocysteine, than patients with uniform pink tongues. Both of these markers are independent risk factors for cardiovascular events. Here's what's happening underneath. Chronic inflammation in your circulatory system shows up at the most distal, most blood-rich tissues first. The tip of your tongue has one of the highest concentrations of small blood vessels per square millimeter of any tissue in your body. When inflammation rises, those vessels dilate and intensify in color before any other visible change appears anywhere else. The practical fix is one of the simplest in this whole video. Cut processed seed oils, soybean, corn, canola, sunflower, safflower for 30 days. These oils are the single largest dietary driver of low-grade inflammation in the modern American diet. Replace them with extra virgin olive oil for cold use, avocado oil for medium heat, and grass-fed butter or coconut oil for high heat. Add 2 grams of high-quality omega-3 daily, wild salmon 3 times a week, or a third-party tested fish oil supplement if you can't get real fish that often. Pair this with reducing alcohol to no more than 2 drinks per week for 30 days. Recheck your tongue tip at the 30-day mark. The redness will fade as your inflammation drops, and that fading is your circulatory system telling you it's recovering. Now look across the surface of your tongue for irregular, smooth red patches with raised white borders. They look like a map drawn across your tongue, which is exactly why the medical name for this is geographic tongue. This pattern is strongly associated with food sensitivities, particularly gluten and dairy, and with deficiencies in zinc and vitamin A. Here's what's happening. The patches are areas where the small bumps that normally cover your tongue, called papillae, have flattened out due to localized inflammation. The borders are where new papillae are trying to regenerate. The whole pattern shifts week to week, which is why it can look different every time you check. That shifting is the signature. For women dealing with autoimmune conditions, undiagnosed celiac disease, or non-celiac gluten sensitivity, geographic tongue is one of the most overlooked diagnostic clues. A 2022 review in the British Journal of Dermatology found that adults with geographic tongue were 3 times more likely to test positive for at least one food sensitivity than adults without it. The practical fix: do a strict 21-day elimination of gluten and dairy. Reintroduce gluten on day 22 and dairy on day 28. One at a time, and pay close attention to your tongue for the next 72 hours after each reintroduction. If the patches return when you reintroduce, you have your answer. That food is inflaming you. In parallel, add 30 milligrams of zinc picolinate daily and a real food source of vitamin A. Pasture-raised liver once a week is the gold standard, or pasture-raised egg yolks daily if liver isn't your thing. Most adults are deficient in both nutrients without knowing it, and both are required for the papillae to regenerate properly. The final sign is the most urgent of everything we've covered today, and I want you to take this one seriously. A dark gray, dark yellow, or brown coating on the back of your tongue, especially if it doesn't lift with the oil pulling protocol I shared at the beginning, indicates kidney stress, liver congestion, or in some cases, a chronic infection that needs medical attention. Here's why this one is different from the white coating. White coating is primarily Candida overgrowth, uncomfortable but rarely dangerous on its own. A dark or yellow coating reflects something deeper: bile that isn't flowing properly from your liver, kidney filtration that has slowed, or a bacterial infection in the digestive tract that has been smoldering for weeks or months. In some cases, it can also indicate the early stages of a serious medication side effect, particularly from long-term antibiotic use. Please don't try to fix this one at home alone. This is the pattern that warrants a doctor's visit within the week, not the month. Ask for a comprehensive metabolic panel that includes liver enzymes, ALT, AST, GGT, alkaline phosphatase, and kidney markers, creatinine, BUN, EGFR, and a urinalysis. If everything comes back clean, you can then move on to evaluating gut infections with a comprehensive stool test. But please rule out the urgent causes first. Let me tell you about Diane. She was a 47-year-old nurse from Atlanta who came to me complaining of persistent fatigue, stubborn weight she couldn't lose, and a tongue that never felt clean no matter how much she brushed. She was eating what she believed was a disciplined diet: green smoothies, grilled chicken, plenty of water. Her standard labs had come back normal 3 years in a row. When I looked at her tongue, I saw 4 of the 7 signs we covered today: white coating across the surface, pale color throughout, scalloped edges along the sides, and cracks running down the middle. We ran the tests I told you to ask for: full iron panel, full thyroid panel, B vitamin markers. Her ferritin was 14. Her free T3 was at the bottom of range. Her B12 was functionally deficient. Every single sign her tongue was showing had a measurable cause. Diane started oil pulling on day 1. We addressed her iron, B12, and thyroid in coordination with her doctor. 3 months later, her tongue had returned to a healthy pink, her energy was back, she had lost 11 pounds without trying, and her doctor called it, quote, a remarkable turnaround. Now, let me bring this home for you. What we talked about today is not really about your tongue. It's about your body finally being given a translator. Every morning of your life, your body has been trying to talk to you. Your only job is to learn the language. The beautiful truth I have witnessed in 11 years of clinical practice is that the body, even at 50, even at 65, has a remarkable capacity to respond when you give it the right inputs. Inflammation drops, energy returns, clarity comes back. It is never too late. You are not just a passenger in this process, you are the driver, and you now have information that most people will never have. If this video gave you something today, please subscribe to this channel and share it with someone you love, a sister, a friend, a daughter who deserves to know what her body has been trying to tell her. And leave me a comment right now. Which of these signs did you see on your own tongue this morning? Tell me, and tell me your age. This conversation belongs to you. I'll be right here reading what you write. I'll see you in the next video. Take care of yourself. You are worth this attention.